Welcome to the Art of Being Human. What I want to do today is kind of finish up this whole section on drugs. But what I want to do is go over, and I think we can do it in one session, if not maybe two, the way that prescriptions are made and also the common drugs that people take. Most people as they get older take something. You know, if it's aspirin for arthritis or some other kind of arthritic kind of medication or heart medication or blood pressure medication, as you get older, your body tends to break down somewhat. And so you are less able to do things as you were when you were younger. And so therefore we turn to medications that we find on television or that are advertised. You go through any kind of a big box store and go through the self-help or the pharmacy section, and there's all kinds of pills that you can just pick up and take. Pills for acid indigestion, pills when your bowels aren't working right, pills for when you're nauseated, pills for this, pills for that. But they're all drugs, and a drug is something that you put in your body that is not necessarily natural to your body, and as a result of that, it changes you. Even herbs change you. And you have to be very careful of herbs because they will interact with other medications that you may be taking. Now when you go to the doctor, they'll say, give us a list of everything you're taking for your medication and anything over the counter that you're taking or any other herb that you're taking, because all of these medications interact with each other. And you might say, well, I'm taking something for an ear disorder, but only if I'm dizzy. But they still want that on the list of your medications, even though maybe you only take it once a month or every 6 months, whenever you need it, but it may not be that frequently. So most people would have a tendency to skip that. But since all of the drugs are interactive and they work with each other or sometimes cancel each other out, it's important that a doctor know exactly what you're taking. I marvel at some of the people who are pharmacists because they have such knowledge of all the interactions of drugs with drugs, but this is what they have to learn, so that when a doctor prescribes a drug, they need to make sure that the drug's not going to interfere with something else that another doctor has also subscribed. And you know, if you're seeing several doctors and you're getting pills from all of those doctors, they may not know, unless they're interconnected with the computer, as many of them are, they may not know what another doctor has given you, and they may not know what you're taking for herbs or something you're getting over the counter and how it influences what you're already taking. So it does become complicated. There's no such thing as a completely safe drug. So putting a drug into your system is putting a substance in your system that will change you. Even non-prescription over-the-counter drugs will change you for better, sometimes for worse. It may depend upon what else you're taking. Drugs can have very beneficial effects, but if it's overused, even just a little bit, it can cause terrible problems. Now, a little too much Tylenol, which is acetaminophen basically, can give you complete liver failure. Now, there's a story about a woman who had the flu. She did not go, and I've told the story before, but I think it bears repeating. She didn't go to a doctor with the flu, but her symptoms were very bad. Instead of going to the doctor, she decided she could nurse herself back to health just by taking stuff she could pick up in a drugstore. So she took, and I'm going to say it's acetaminophen, but it may have been something else. I don't remember for sure. But if it says 2 pills every 6 hours, she thought maybe if she took a little extra, it would help her. Because if 1 pill helps you feel better, doesn't 2 help you feel twice as good? Not necessarily, but that's what she thought. And that's what many people would think. So she overdosed a little bit. I don't know how many extra pills she took, but she took a little extra, thinking that it would help her and it would make her feel better sooner. Well, after a few days, she had a terrible problem. She was very sick, and she had got into acute liver failure. Why? Too much. The directions were however many, two every 6 hours, or whatever they were. I don't know what they were. But she went overboard, and she didn't have to go overboard much. You take a little too much acetaminophen, you're going to have a big, big problem. As a result of that, the only thing that saved her was she had to have a transplant. And now she's taking anti-rejection drugs for the rest of her life so she won't reject transplant. So this is all by taking a little bit too much extra of something that was prescribed by the company, and they know how much is okay, and they know how much is too much, and they print that out so everyone can read it. It's no secret. But if you deliberately go above that amount, you can have a terrible problem. So there were other things. There's a radio personality. I've heard him. I usually don't listen to him. And he had a problem, and he took too much of a medication, and he went deaf in a half an hour. He was on the radio when it happened. He started talking for his normal radio show. He's very popular. A lot of people listen to him. I don't, but a lot of people do. And in a half an hour, he was completely deaf. And he could not hear. He just absolutely could not hear. And it's a show where people could call in and make comments, but he couldn't hear what those comments were. So they had to shut down the show because he couldn't do it. Now, later on, a few months later, I don't know how much later, but he had a cochlear implant, and that restored his hearing, so he was able to resume the show. And I'm tempted to say, well, if he hadn't been fooling around with the drugs, then he wouldn't have gone deaf. But the thing is, he probably didn't take much more than what was prescribed. He probably didn't go to a doctor. He probably had something wrong, and he decided to take a little extra or a little more. But within a half an hour, he was deaf. Now, there's a case, and I haven't seen this advertised for quite a while, but on some home shopping networks, there was a man who had herbs, made herbs instead of shampoos, and there were some people, some of the hostesses on the show said they had used these herbs instead of shampoos for 6 years, and their hair was beautiful, and it did look beautiful. It really looked very nice. But then I discovered that he was being sued because they put these herbs on a child, and the child's hair fell out in globs, hair. So he was being sued because she didn't use a child's shampoo. I suppose they thought that these herbs, they make your hair good, they make your hair shiny, they make your hair so it's not snarly, and it's beautiful to look at, and it's easy to handle. And there was a series of herbs that he had to do certain things. So some people were using more than one bottle. But when it was used on this child, the child's hair reacted somehow to it, and she lost her hair. Now, maybe there was a medical condition, but I know he was being sued. Or it may be that the herbs were too strong for a child. You have to remember that a dosage for a child is not the same as a dosage for an adult. And the reactions of a child to medication is going to be quite a bit different than the reaction of an adult. So what may be good for an adult can't be given to a child because the child's system isn't mature enough to react in the same kind of way as an adult does. So you have to be very careful of that. So you need to be careful of your behavior and in terms of what you have. Now, I knew about a woman who was taking a medication, and it had silver in it. And it was supposed to help as a cancer preventative. I can remember at the time, I think it was colloidal silver. And I don't know how much she took, because she must have taken quite a bit. But it was touted for a long time as a health thing, and you could take drinks of colloidal silver, excuse me, and all of that. Well, her face, it couldn't metabolize all the silver that she had given it, and her face turned silver. The silver in the colloidal silver deposited itself on her face, and it was permanent. You couldn't get it off. She couldn't get a job because in the light she just shined, she reflected light because her face was covered with silver. Now, if it was cloudy out, you didn't notice it so much. People have taken medications like that and turned blue. Their skin has actually turned blue, and it's been permanent. There hasn't been any damage to the organs. The person can function all right, but they certainly don't look the same, and people don't react to them the same because their skin has changed color, or it's become silvery, it's become shiny, and it's a permanent thing. You just can't get rid of it. I don't know if makeup can cover it up, possibly. I don't know, but here it is. You have to be very careful of what you take. And so I just need to let you know that there are dangers in taking herbs. Now, the danger of taking herbs, as I see it, and I'm not trying to steer you away from it. You need to go to somebody who has knowledge of herbs and how much is safe to take and what you take it for and how the herbs interact with each other. This is a whole field of study, and you don't self-medicate. You go to somebody who knows what they're doing so you don't get into dangerous situations. But you have to remember, herbs, if you buy them on the market, you may not know what kind of a dosage you're getting. It may not be controlled. The Food and Drug Administration may not say, definitely you have to have certain percentage of this to call it that, If it doesn't have that kind of oversight, then you may get almost nothing in terms of what you think you're buying, or you may be getting way too much of what you think you're buying. And the thing with herbs is that they're going to interact. They're powerful. They are drugs, and they're going to interact with whatever else you're taking. So if a doctor has you on a regimen for certain kinds of drugs for whatever purpose that they have in mind for you to take them, and you're introducing herbs, you may do one or two things. You may cancel out the effects of the herb or a medication that you're taking. The medications may cancel each other out, in which case you don't get any benefit at all from what's going on, from what you're taking, or they may exaggerate and make a certain medication, boost it so it's stronger. It may be too strong, but it would be stronger. But you need to go to somebody who understands how the herbs react with each other in order to be safe. I'm not saying don't take herbs. I'm not saying don't take medications. I'm not saying don't take vitamin pills. But you need to have a balance, which is why doctors are always saying, put down everything you're taking, even if it's not a prescription. Put down everything you're taking. But these substances do react against each other. Now, here are some hidden problems with some medications that you may be taking. Let's take a look at acetaminophen. Acetaminophen is a very common kind of medication. You find it in Tylenol, Excedrin, Percocet, Sudafed, Lortab 600, and over some other over-the-counter medications. I remember buying a cold remedy, and it's a popular cold remedy, and it has basically hot tea. You put it, you cook it, heat it up so it's like a hot drink, and you drink it. But it's basically a hot tea with acetaminophen in it. And it's supposed to be for cold. You drink it, and it helps you control the cold, the symptoms of your cold. You don't get so much fever. You don't have so much body pain. Well, why not just take an acetaminophen and have a hot cup of tea? It would be a lot cheaper if you did it that way. But at any rate, what does acetaminophen cause? It causes acute liver failure more than all other medications combined. It's dangerous. It's dangerous. Even a little over the recommended dosage can cause liver damage. That's from acetaminophen. Okay, NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, naproxen, Celebrex, and other COX-2 inhibitors. These are the medications that have NSAIDs, aspirin, basically. Now, if you take them over a long period of time, it triples the risk of a stroke. even at the normal recommended dose. Patients taking Celebrex had twice as many heart attacks as those that were taking a placebo. So even that can be dangerous. I take aspirin every day for my heart, but it's given to me by a doctor. He knows the dosage I'm taking, and it's a full dosage. It's not a baby aspirin. It's 325 milligrams. It's a full dosage every day because of the fact that I have a fairly new stent. They don't want anything sticking to that stent, and at some point he'll take me off the aspirin, but he hasn't yet. It's been over a year. So there are times when you really have to take what you have to take. There was an article in the news, a show on the news, saying that it caused that you were 16% more likely to have a stroke if you were on aspirin than if you weren't on aspirin. But the recommendation was, if you're on it for heart problems, you need to go to your doctor. He probably is going to want to keep you on it. If not, go to the doctor and find out what is the safe dosage for you to take, if you should be taking it at all. This is just a recent report. Okay, now the narcotics would be hydrocodone, methadone, oxycodone, and this causes drug dependency, and there is also a risk of bone fracture, heart attack, and death from these. A lot of people take those drugs. They're opioids. You can actually go too far in taking opioids. And then you have the corticosteroids. These would be cortisone injections. Why would you get a cortisone injection? Well, if you have bone problems, joint problems, and pain, like in the shoulders, elbows. I had one for my finger. You can get what's known as a trigger finger, where the finger flops forward. I mean, I'm making this happen. And you can't get it back up. And so you have to have a cortisone injection. And it does thin the muscles, and it makes it possible for you to recover from that. But it is an injected cortisone. It can crystallize and cause pain and a whitening of the skin in the injection site. Those cortisone injections are really, really painful. So, but there are some people who need to have them. You can only have, I think, 2 or 3 within a certain period of time because it does thin muscles and so forth. But there are times when you really need to have them. So you just have to be careful. Now, the word drug refers to medications which are substances that cure or arrest diseases, or they relieve symptoms, or they relieve pain. And that includes vitamins and minerals that are essential for health. And sometimes they're given to correct a deficiency. So if you're on a drug, it's because you either lack something in your system and it needs to be replenished, or else it is going to ease symptoms that you're having, or it's going to put your body in some kind of balance. The body needs to be in homeostasis, and homeostasis means that everything is in balance with each other. The body works together, the organs work together, everything's in balance. But if you are ill or something's wrong, things are not in balance. And a lot of times a drug will be given to you, especially psychiatric drugs, to keep the brain chemistry level so you don't get such symptoms for mental illness. You don't get the hallucinations and the delusions and things like that. Now, most people who are mentally ill don't get them anyway, but there are certain illnesses, certain mental illnesses in which people will hallucinate or have delusions. Hallucination can be auditory or it can be visual. It's either seeing something that's not there or hearing something that's not going on, auditory or visual. And if it's visual, it's very powerful. You can see beings around you. You can see all kinds of things. I was a professor at a college, and I was there for a few years, and I loved it there. But there was one guy that was a stalker, and he had a mental illness. His was schizophrenia, or some form of it. There are different forms of schizophrenia. He had a form of schizophrenia, and he was stalking me. And he would go around wherever I was, And if I was walking across campus, it got to be creepy, because suddenly I'd notice he's watching me from behind a tree. He didn't want me to know that he was watching me. Or he'd be there wherever I was. Or he'd lean against the glass door to get a better look at me if I was teaching a class. And it absolutely got to be dangerous. But we had him in, the dean, myself, and him in for a special meeting to discuss his behavior, because it was getting to the point where a lot of the husbands of the female professors weren't going to let him teach, because they figured he was too dangerous to be around, because he would make threats. He was the one who put a razor blade in my hand on the first day of a class. That it was my first year there, and he was the first one in my class, and I'd never taught there before. It was a psychology class, and he put this razor blade in my hand, and I says, "What are you doing that for?" I knew something was wrong, obviously. He says, "This is what I want you to defend yourself with when I come to kill you." And that was my first introduction to the student in a brand new school in the South that I happened to be the new professor in the psychology department. So we had him in, and as we were talking to him, he's saying, "Look at those bugs crawling up the wall. They're all over the curtains. Can't you see these bugs all over the wall?" Well, there weren't any bugs all over the world. He was having a hallucination. So we had to say he could no longer come to school. I had to have protection. I had police protection. And when I left the campus, we had to make sure he wasn't there. They got some kind of an order from the police department. He was not to be on campus. But of course, what good does that do if he doesn't understand it or isn't going to obey it? So it was kind of a rocky first year. I did stay longer because I loved the school. I loved the teaching the college kids. But at any rate, you have to be careful, because some people do need medication to balance off their brain chemistry so they don't get those kinds of symptoms. Delusions are believing things that are happening to you, not seeing them, not hearing them, but believing them. Believing that somebody from Mars is spying on them because they've got some kind of a device where they can look across space to spy on a particular individual for whatever purpose. So these are the kinds of things that people whose brain chemistry is out of order, they have a problem with, and they have to have that go brought back into balance. Of course, drugs can cause all kinds of dependency, but psychotropic drugs can do a marvelous work. And many of the drugs that people used to take were herbs. Now they are, many of them, just synthesized in laboratories. And when a new drug is tested, it's tested for 6 to 10 years to make sure it does what it's supposed to do, and then it's given a series of names, a chemical name, a pharmacy name, and a general name that people will be able to remember. And a company can have a jurisdiction over a drug and be the only one that manufactures that drug for 17 years, and then others can start manufacturing the same drug with different kinds of names. It gets to be a little complicated, but the drugs are important. We can't live a healthy life if you're sick unless you do the medications that you're supposed to do, or do it naturally with herbs, as long as you're going to somebody who knows what they're doing. But at the same time, life without drugs, if you can do it, may be far better. But as you get older and older, things happen. You get illnesses, the gallbladder kicks up, this happens, that happens, you get cancer, and you're going to need to have drugs. You just need to be as safe as you can with them. Well, we're about out of time, and I'm going to close it here. We'll be doing something else next time. Please join me then.